This is One on One. Dr. Raul Parra is medical director, Regional Cancer Center, Holy Name Medical Center. Good to see you, doctor.
Nice to have you.
You're here to talk about prostate cancer.
Yes.
I said to you right before you get on the show, I said, so 1 in 7 men dealing with the prospect of prostate cancer in a lifetime. You said no, 1 in 6.
Correct.
That common?
Yes.
Who's most susceptible?
Well, every man eventually will have some form of prostate cancer if they live long enough.
Is that true?
Yeah, it's true.
Why is that?
Nobody knows, but it's probably genetic. It's a combination of genetics and hormonal and predisposition. And it's just a fact of aging may predispose you to develop certain types of cancer, and prostate cancer is the most common cancer in men.
Who should be tested and when?
That's a good question. There's been a lot of controversy lately because of PSA screening.
The PSA screening, the test.
Correct, which is an acronym for prostate-specific antigen, which is basically a protein in that is detected in your blood that is secreted by all prostate cells, but is higher when there is a cancer in the prostate.
So, men ages 50 to 70. Mm-hmm. Is it fair to say that is the age group most susceptible?
Correct. Actually, it depends also on your race and on your family history.
Race and family history, break that down.
Yeah. The risk factor for prostate cancer, aside from age, is if you're African American or have a family history of prostate cancer in which either your father, your uncle, or one of your brothers has been diagnosed previously with prostate cancer, places you at a higher risk of developing prostate cancer earlier and possibly with a more lethal type of disease.
Why?
That's unknown. Really.
It is unknown.
It is unknown, but there's a lot of new developments, and it looks like it's a genetic predisposition in which mutations occur at a cellular level that predispose some men to develop this disease.
Doctor, go back to the African American men issue that you said that African American men are more susceptible. I hope you're not going to tell me we don't know why. Do we know why?
No, we don't know why.
We don't know, we have no idea.
No idea. There are some inclinations that it may have to do the way that certain hormonal changes occur, some genetic predisposition, which there may be some genes related to it. And in the past, people thought that because of the pigment in the skin.
The pigment?
Yeah, you would not.
Is that clinically proven?
No, it hasn't been proven. But a lot of these things are suggestions that have to be totally proven. But in reality, I think it's also been a fact that African American men in the past had less access to early detection than the counterparts.
Talk about this part of it. Early detection is key, but also monitoring is key.
Yes.
Talk about that.
Well, monitoring is really, once you have a PSA test done, I like to define it that way. I think it's very important that men, in my opinion, I know goes against a little bit of what the task force has recommended. I don't know if you read the recommendation by the U.S. task force on PSA.
Which, the U.S. task force, like the federal government got into this?
Yes, and they created a panel in which they reviewed the data that was available. By the way, there were no urologists in the panel.
Hold on, no urologists who sat on the federal government's panel on prostate cancer?
Correct.
I don't even know what to do with that, but go ahead.
I don't either. But the recommendation was that based on the data available, there was no benefit in testing men for prostate cancer, that the harms from early detection far outweigh the benefits. On the other hand, I think that we have to use judicious screening. And the recommendations by the American Urologic Association is that men under the age of 40 really have no benefit in early detection. But however, we should probably obtain a baseline PSA around 45.
45 baseline?
Yeah, 45 baseline.
How often after that?
If your PSA is less than 1, you should probably wait 10 years and get it tested again.
If it's higher?
If it's higher, between 1 and 3 every other year.
Higher than 3?
And higher than 3, you should have a biopsy.
You should?
Yes. If you start getting older, by the age of 75, probably it's not worth getting a PSA.
Why?
Because a lot of men at the age of 75, even if you detect prostate cancer, they're probably going to die of something else.
I shouldn't laugh, but you're probably going to die of something else.
Yeah.
By the time, I do this in the time I have treatments. How are they different? If you have it, it's got to be treated. How has it changed?
There's a lot of improvements in treatment. For younger men, those men who have a life expectancy of a minimum of 10 years, we recommend surgery. And most of the surgery is done now at robotic, in which the functional outcomes are excellent. And there are other methods that have improved also, such as radiation therapy. And even in men with very advanced prostate cancer, there are new medications available that actually prolong life and actually, in some instances, actually cure patients.
You've seen tremendous progress in this field.
Yes.
How many years have you been in it?
Over 34.
I need to ask you this. Why did you decide this field?
Why?
Yeah.
I thought it was extremely interesting when I was going to be a cardiothoracic surgeon. And because everybody that was a surgeon in those days, I have to operate on the heart. But when I rotated in cardiothoracic surgery, I didn't like the type of lifestyle, the type of surgeons that were there. And I rotated with the urologist. And I said, this is a common guy. And I liked it. And I liked the cancer field, and I like cancer surgery.
Dr. Raul Parra is a medical director, Regional Cancer Center at Holy Name Medical Center. Doctor, I want to thank you. It's very important information that everyone needs to be thinking about, particularly the men out there, regarding prostate cancer and protecting ourselves and staying on top of it. Particularly men of a certain age. I've heard that before. Thanks,
Right.
Doctor.
Thank you.
Stay right there. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, TD Bank, the New Jersey Education Association, PSE&G, New Jersey Sharing Network, NJM, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.